What's next in that area seems to be a treatment called the quad, that you call it, and the industry calls it a 4-in-1 pill, 4 medications in one.
Yeah.
You've got a lot, very high hopes for that. Why have you invested so much time and energy in this?
Well, the therapy of HIV, it involves the patient taking multiple pills or multiple different drugs. And we recognized quite a few years ago if we could combine that all into one pill, the patient would benefit. People fail HIV therapy if they don't take all their medications. So if they're all in one pill, you take all or nothing.
Right.
And that's very beneficial to the patient. We've seen it in terms of outcomes. Just in the general population of less resistance, less need for second-line regimens. The key is to come up with future single-tablet regimens, and the quad will be one of those that contains a very important inhibitor called an integrase inhibitor. It's a new class of molecules.
You have focused on the actual real-world patient behavior beyond just the chemistry and biology of the medication.
We didn't have, until Gilead developed them, the molecules that could be used once a day and combined. Medications had to be taken 3 or 4 times a day, with and without food.
Right. And sometimes a dozen of them or more. Right?
Yeah, up to 35 pills a day historically, and it's just very, very difficult for the individual patient. So our breakthrough was to come up with the first nucleotide for the treatment of HIV called Gilead. We launched that almost 10 years ago now.
Making it essentially user-friendly, right?
Yeah, so then we developed a second drug called emtricitabine, combined that with Gilead for Truvada. Then for the third drug to use in combination, we did a partnership with Bristol Myers and Merck for their efavirenz. And that product's called a triplet. It's been on the market since 2006.
Right. And seems to be the number one recommended.
It's the number one regimen used in the United States.
Gilead developed Tamiflu, right?
Yeah, we discovered and helped develop it with Roche. Roche is our commercial partner on it, but it's a product from about 15 years ago that was synthesized for the first time ever right here on this campus, and we were able to very rapidly get it into treatment and prevention studies, so that it got approved after really only a few years for both the treatment and the prevention of influenza. And then, as we were talking about our concerns with pandemic flu, it has been stockpiled by various countries around the world as a defense against the spread of the virus.
Can we be fairly confident that it will continue to be effective for a while?
That's the concern.
Or that the virus will mutate and so
forth? The thing about drugs for the treatment of infectious disease, whether it's antibacterials or antivirals, is drug pressure leads to resistance. Right. And that's why we continue to need more agents for all these categories.
I've heard this concern raised with regard to HIV treatment as well, that we have a very successful treatment now, namely the things that Gilead produces, but this will lead the virus to respond somehow.
That's correct. And so we need to continue to come up with more agents. For instance, the quad pill that we talked about earlier, we believe will be very important as an additional weapon against the treatment against HIV.